So I mentioned earlier for the front line, the non-CD30 positive, the Alliance, which is looking at CHOP, CHOEP versus CHOP with azacitidine, oral azacitidine, or CHOP, CHOEP with the dualisib. So that's trying to answer the question. It's a large study. And azacitidine has particularly been helpful in T follicular helperphenotype lymphoma. The dualisib is also shown to have a response in the relapsed refractory setting, perhaps to T follicular helperphenotype lymphoma. Obviously, the study is looking at all comers, and if it is enriched for TFH, I think you'll have a clear signal. If it is not, then we don't know what might happen to the study. And the question is also, it's a larger study, and we all have to participate, so we can make sure that the accrual is met. The relapsed refractory setting, there are CAR-T studies, and one of the most exciting areas is both allo and autocars. Autocars have always been a problem in T-cell lymphomas because it's a T-cell, and you have a T-cell directed again, engineered T-cell trying to get rid of a malignant T-cell clone, and that can be a problem because the target that you're going after can also knock off the normal T-cells, whether it's CD5 or CD7. But now there are approaches that are looking at TRBC1 target that Dr. Kate Swinarski is looking at in UK at her center, and it's early promise. We have an allo CAR-T, which is an international study looking at a target called CD70, which is not expressed in a lot of the normal T cells. So I think we've had an EHA presentation and then an encore at EORTC a couple of days ago, and the response rates are in the 70 to 80% range across CTCLs and PTCLs. So the CAR-Ts are more exciting. There is also the CD5 CAR-T designed to the myeloid that's coming up, which is using short CARs as opposed to the long CARs, and it's a very innovative approach, and perhaps it can get away from some of the side effects that you see in the longer term. So that's something we need to look carefully into. Then there are several other second generation, third generation PI3 kinase inhibitors, like the limpersilib, the valemetostat. And the valemetostat has been approved in Japan recently for ATL, and it has activity in nodal T-cell lymphomas. So I think it's a very active compound. The do not eat me inhibitor, the anti-CD47, SERPIN alpha axis. So these are, I would say, pay attention to these. Probably will have some approvals very soon, if not in this year, later next year.